When we started this program, one of the realizations we had is that if we're a healthcare organization, we ought to have a commitment to the health of our employees as well as the people that we serve, and that not only would that be good for the organization and the employees, but it would also kind of teach by example rather than by lecture to our patients that they need to be responsible for their health care and that we're willing to support them to be and stay healthy.
One of the things that Hudson River Healthcare realizes that we're all human beings and that doctors have the same issues and nurses have the same issues that everyone else does. With this Step Up for Wellness program, the doctors, nurses, and the healthcare professionals that work here have really found that they've been able to adopt the same healthy behaviors that they've been recommending for their patients. Patients see this and say, hey, my doctor may not be a Twiggy or a very, a perfect person. However, they are working towards this with me. So they feel more like they're actually on the same journey and getting better.
I think that we have already seen benefits even after just 2 years of our program being implemented with our whole staff. We have a staff that is engaged in their job, who loves their work. We've created a real team spirit here at the health center. We have reduced our staff turnover, reduced our employees using sick time. So as an employer, it's a win-win all around for both our staff and us, our organization, as an employer.
One of the things we found with the staff wellness program is that we've actually taught our staff how to engage in some healthy behaviors. For instance, we've done food demonstrations and showing people how to reduce fat, sodium, and increase fiber in their diets. And what's happened is people at every level, and this includes the physicians that work for us all the way down to the facility workers, have taken something away with them. They've learned something. And so as the providers, medical providers, use this information, they're using it in their practice. They're actually sharing some of the things they've learned with the patients. And I think that as providers, our providers are also finding that when they can say to their patient, look, I've actually increased my walking by using my pedometer, the patient then is more likely to say, hey, if my doctor's doing this, I'm going to also get behind it too. So I think that that's definitely a side benefit that we didn't realize. I would say that what we have seen as a business has really been an increase in how well people work together. So we found about half of our employees join the Step Up for Wellness program. And of those people, we had about 44% who lowered cholesterol, about 43% who lowered their blood pressure. We had about 55% who lost weight, and we have about 38% of the people who were smokers, they were able to quit smoking. So we found that we had great results.
I think three of the major things that we found is a reduction in the number of sick days, an increase in productivity as reported by our providers and by the statistics we've maintained, and also an opportunity to actually negotiate a reduction in our health insurance rates.
I think we've learned a lot from the implementation of this program. We've learned that for a small amount of money, a small investment, you get big bang results. Our staff are happier, we're a more efficient employer, and I think long term we're going to have a healthier workforce. I also think that on a community-wide level, we really see this as an opportunity to move further and deeper into the community and provide our community at large with health and wellness services. So the health center is more than just about its employees and its patients, but it has a huge community impact, and we hope to look to that for the future.